Hey, happy Tuesday. This is Jane, and I'm back at you today with another installment in Pulmonary Hypertension Awareness Month. And today I'm going to talk about diagnostic testing. So, yesterday I talked about Nicole's story, her diagnosis. And so now I'm going to talk about the testing that is done for the diagnosis. Hey, Jim, how are you today? For the diagnostic testing that's done. Now, some of this testing is also done after you're diagnosed, and I'll talk about that too. Okay, so the first, and I'm looking at my computer screen because I am in phassociation.org, and I'm reading from there. I'm reading what each one is, and that way, you know, I say it better reading it from there than if I had to make it up myself. So the first thing is blood test. Okay, so the blood test check the oxygen levels in the blood. They observe liver and kidney function, and they identify whether the patient has collagen vascular disease, thyroid problems, any signs of infection, HIV. One test is the brain, nucleotide peptide, or BNP, and that helps assess the strain on the heart, and it also is used to monitor the response to treatment. So, Nicole, as far as blood tests go, the BNP, usually every 3 months Nicole gets that tested. The higher the number, the higher the congestive heart failure. Or the strain on the heart. I think they use it for congestive heart failure too. Hey Danielle, it's nice to see you today. And hi Evelyn. Hey Crystal. Thank you all for joining. So Nicole, one of the medications that Nicole takes, and I'm going to talk about the medications as we go along in the month. One of the medications Nicole takes causes severe birth defects. So because of that, she has to have a pregnancy test each month. So on the months that she doesn't have to have any type of blood work, which is not that many, she will have a urine test done. But if she has to have blood work, then she will get it done with the blood work. And so for Nicole, the testing is CBC, complete blood count, metabolic panel. She tends to run low in potassium. The liver testing, test the liver, and I think that's about it. The next test is a chest X-ray, and they can reveal an enlarged right ventricle or pulmonary arteries, and they can also show signs of emphysema or scarring, like interstitial, I didn't say that right, lung disease. Chest X-ray, as far as the chest X-ray goes, Nicole gets a chest X-ray usually once a year. EKG, or it says here ECG, I've always known it as an EKG. They attach the electrodes are placed on the skin, and this is how Nicole was initially diagnosed with the CHDs, was through that. Nicole will get one of them about every 3 to 6 months. It depends on the doctor. All these tests and how often you would get them once you are diagnosed with PH is up to the doctor. And then there's the echo. And in this procedure, electrodes are placed on the patient's skin and a sonogram of the heart is taken. The painless procedure is often used to make a preliminary diagnosis by estimating the pressures in the right heart and assessing how well the heart is functioning. Other heart conditions that produce symptoms similar to PH may be diagnosed with an echo. And in addition, an echo may be used to monitor a patient's condition, and that's exactly true. And Nicole gets an echo every year. So annually, she gets an echo. That is how she was preliminary diagnosed with PH, as I said yesterday, was with an echo. Then there's pulmonary function test, and these tests measure how much air in your lungs, how much air your lungs can hold, and how much air moves in and out of them, and the lungs' ability to exchange oxygen. And these tests, Nicole gets a PFT. They're also known as PFTs, once a year. Then there's the exercise tolerance test, and that is the dreaded 6-minute walk. And basically that is just that, a 6-minute walk. You walk for 6 minutes, and they record your pulse ox, your blood pressure before and after, and they use this. Nicole has this done about every 6 months to a year, somewhere in that range. And they can look back and see how well she's doing. Is she declining in her distance, or is she staying the same, or is she improving? Then there's the VQ scan, and that is a test for blood clots in the lungs by producing a picture of air and blood flow to the lungs. A small dose of radioactive material is breathed in, and another small dose is ejected via blood vessel into the lungs. And then the doctor will review the images that are produced to evaluate the health of the lungs. Now, Nicole doesn't need to get this on a regular basis. She has had one before, but that was in conjunction with being at the transplant center and being evaluated for transplant. Let me flip up my screen. Okay, so the gold standard for a pH diagnosis is the right heart cath. And the right heart cath, let's see, it's one of the most accurate and useful tests to get a definitive diagnosis for pulmonary hypertension. This is the only test that can directly measure the pressure inside the pulmonary arteries, and it should be done in all patients at least once to confirm a patient's diagnosis of pH. During the test, doctors insert a catheter, which is a thin rubber tube, through a large vein in the patient's groin or neck. I believe they can also do it through the vein in your arm. Then they pass the catheter up into the patient's heart to measure the blood pressure in the right side of the heart and lungs. Now, yesterday I talked about Nicole being diagnosed from the echo. Okay, she did a couple weeks later get a right heart cath, and we traveled to Tampa for that because the cardiologist did the right heart cath over in Tampa. I don't know why, I don't remember, but so we did travel there. That is where we were told what class she was in regarding her pH, which I'll talk about that tomorrow, and that is basically the stage that the disease is in. And so it was at that time that, we found out that they couldn't correct the holes in her heart or she would die. And basically that her lungs were beyond repair. They couldn't reverse the damage to the lungs. Every doctor is different with a right heart cath. It is invasive, so every doctor is different. Nicole hasn't had a heart cath since January of 2013. I know she will be getting one here soon at some point. So, but that is what's going to be the diagnosis, and usually from that right heart cath is they immediately put you on medication for pH. That's what they did with Nicole. They started her on Revatio, which is the same thing as Viagra, and they kept her in the hospital for about a day and a half, and they monitored her blood pressure. And then they also started her on oxygen. We'll talk about oxygen when I start talking about the different medications. And then there's a vasodilator study, and this study is used for patients who have already been diagnosed with PH to determine how much their pulmonary blood vessels can relax over a brief period of time. Its main purpose is to screen for patients who might respond favorably to calcium channel blockers, CCBs, a form of medication. The test can also help determine the patient's prognosis. With the right heart cath in place, the patient is given drugs that relax the pulmonary artery, and the test drug is given to the patient in higher and higher doses, pausing at each dose to see how the patient reacts. And once a significant response occurs or the side effects become intolerable, the test is considered complete. Now, Nicole did have that with her initial right heart cath, and that is how they that's how they knew that she did not respond and would not respond to CCBs. So those are all the testing that they do for pH diagnosis. And oh, wait a minute. Oh, I can flip down my screen. Well, geez. Okay. Hey, Crystal. I hope your day is awesome. Thank you for joining, Cindy. Thank you, Kathy, for joining. Thank you, Mary, for joining. Thank you, Cheryl, for joining. Yes, that's what I was trying to say, and I'm not going to try and say it again, Danielle, because I will not be able to say it. But yes, it's a lung disease. Yes. Hey, Ruth, how you doing? So I thank everybody for joining me. And tomorrow I'm going to talk about, oh boy, what was I going to talk about? Give me a second here. I have it written down. Maybe I have it somewhere. No. I don't know what I'm going to talk about. Oh, I'm going to talk about the classes of pH. Okay, so thank you so much for joining me. I hope you have an awesome rest of your day. And no, I'll talk about oxygen, Danielle, probably when I start talking about the different medications, which I'm going to start doing probably, what's today, Wednesday? I probably will do it on Friday. That'll be the start of the medications. I'm going to go through every day and talk about different medication. So I hope you all have a wonderful day. Love you all, and God bless.